Hi everyone, it's Dr. Jhawar with Revive MD. It's Heart Health Month, and one of the biggest leading causes of heart disease is high blood pressure, the silent killer. So I want to talk to you all about how to measure your blood pressure accurately with machines and monitors that you can find at drugstores. A lot of patients ask me about wrist monitors to check their blood pressure, and sometimes I cringe because they're not the best type of monitors to use to check your blood pressure. There's a few reasons for that. One is that the arteries in the wrist are actually very narrow and they're closer to the skin. So when you actually use a wrist monitor, you can get falsely elevated blood pressures. The second reason is that the level of the wrist is not at the level of the heart. And so, unless you are actually positioning yourself accurately and having your arm and wrist at heart level, you're not getting a very accurate blood pressure reading with a wrist monitor. So, it's a little cumbersome to remember all of those details to just get a proper blood pressure reading with a wrist monitor. Instead, I do recommend using a digital arm monitor because, again, the arteries in the arm are deeper, and so you'll get a more accurate blood pressure reading that way. Of course, if you have a healthcare professional at home who can do an analog blood pressure reading, which is using a manual blood pressure monitor, that is the most accurate. But if you don't have that at home, a digital arm monitor is a really good alternative and can give you some accurate readings as well. It does also depend on what kind of cuff size you are using. So make sure that you choose the right cuff size and get the proper cuff size, because if it's too small or too tight, you could get false readings on your blood pressure as well. So I hope this gives you an idea of why certain blood pressure monitors are better than others, so that you can start checking your blood pressure and get more accurate readings when you do. I hope this helps, and I'll be back with more videos.